Hello, lovely. How are you? Good. I'm Dr. Nicola, and I'm your e.n.t specialist. It's nice to meet you. So, I believe you're having trouble with your sinuses. Okay. I do have your referral, but if you could just tell me a little bit about what you've been experiencing. Okay. Okay, so quite frequent. How long have these been happening for? Okay, so you're probably looking over a 12-month period. Alright. So you're getting sinus infections, migraines, pain in the face. Okay, swollen. Yeah, typical sinusitis symptoms. Alright. Okay, so how many over the last 12 months have you had? Okay. You definitely have chronic sinusitis, but there must be some underlying problem. I wondered if we may have some nasal polyps or something like that. Okay. Yeah. When was the last flare? Okay. So between the flares, are you still having quite a runny nose? Okay, so a lot of sniffing. Been having nosebleeds at all? Yeah, occasionally. Alright. Whereabouts do you experience pain? Okay, and where do you notice swelling? Right, okay, and it comes quite up. Okay. What about sore throats? You've got any sore throats or anything like that with that swollen glands? Any ringing in your ears? Any vertigo, dizziness? Any fainting or seizures? I know you're asthmatic. Okay, what about hay fever? Did you get that? Is that every year? What's it like normally? Okay, so what about since you've had this? Unbearable. I can imagine. You poor thing. Yeah. So, any other allergies? Okay. What about medical problems? You diagnosed with anything? Okay, so what medication are you on? Yeah. Okay. That's fine. Are you aware of any deficiencies at all? Okay, that's fine. Okay. Any recent coughs or colds? Any flu or COVID or anything recently? Okay. Any vaccinations? Okay. Okay. So, are we in any pain today? Okay, well that's good. You do sound stuffy in the nose, very stuffed. Is that normal for you? Okay, so you do sound quite snuffled most of the time, even when we haven't got a flare. Okay. Now, how often would you say you get the nosebleeds? Okay. Now, if I can get you to just sniff for me, but very gently. Okay. Again. Okay. Now, some tissue next to you. You can have it by your nose. I want you to sniff out, if that's possible. Okay. Okay. Can you give me another go? Okay, that's fine. Right, you can wipe your nose and just pop that in the bin for me. Right, good. Feeling okay? Perfect. If you just look at me, do your eyes ever get quite watery and red? Okay, I'm just going to pull down. All right, is that okay? Good. Okay, I'm going to lift up. Okay, it looks fine. All right. I'm just having a look. I want to see if I can see any obvious swelling. Got no metal plates or pins or anything in your face. All right. Any piercings? Okay. Any problems with your jaws? Okay, that's fine. Okay, so your jaw's good. Can I just get you to open, close, open, close. Now can you chew for me? Slight bit of a clunk. Okay, relax. Do you have any joint issues? Okay, so you're not necessarily diagnosed, but are you aware of any clunking, any clicking, any getting stuck or anything like that? Cracks, popping? Okay, and whereabouts? Okay. Well, maybe see how that goes and then speak to your doctor about it and actually get that assessed. All right, because that, needs to be looked at really, and it could be linked to your jaw. All right, okay. I mean, your jaw can actually give you migraines and that as well. Okay. Now, with your teeth, are your teeth all your own? Okay. What about your wisdom teeth? Have you got them in or out? Okay. When was that? And why? Okay, that's fine. So your teeth in general, so they're quite healthy. All right, if you open wide for me, have a look. I'm not a dentist, but I can have a little look at things. Okay. Say R for me. Okay, relax. I'll have a look in your mouth afterwards properly. Right. Okay. I'm going to touch now. I'm going to be concentrating obviously on your sinuses, but I'm going to be feeling around all of your face. I'm looking and feeling for any differences, any changes, any abnormalities. Okay. At any time, if you feel any pain or any discomfort, if you can please let me know. Anyone in your family got any sinus trouble? Okay. Right, so to touch, it does feel okay. Can't feel anything obvious. Okay. So would you say sometimes you get quite puffy there? Yeah. Oh no, don't worry. I know I don't expect people necessarily to come to me when they're in a flare-up, so I mean, it sounds to me that you're always pretty much struggling with it anyway, even when you aren't in the thick of it. Yeah. Because there's still a problem there, and that still needs to be resolved. Does that hurt at all? A little bit. Just cheekbone a bit. Okay. Okay, try the other side. Any pain this side? A little bit. Yeah, okay. Okay. Uncomfortable. Never get any cold sores or ulcers. Have you ever had your ears cleaned? You're doing well. Any plastic surgery being done? Okay. I'm just going to rock slightly. How's that? Uncomfortable? Yeah. So if I go like that slightly, I can hear the squidging. There's a lot of snot up there. I'm just going to squeeze. If you can just hold the tissue underneath. I know, I'm so sorry. Yeah, okay. You can wipe so I can hear the squidgy and the mucus coming out Slightly, yeah, so it's really quite runny. Yeah, so you've not got a cold or anything, so yeah, okay. You're looking a bit sore there. I'm thinking all the excess blowing and wiping your nose, it's not doing anything good for your skin, but there's not a lot we can do about that at the moment. But you must get really sore. Okay. How's that? Yeah. Do you ever get puffy eyes underneath? You can see you've got a slight bit of dark circles. That's why I was wondering if you experience any puffiness. Would that be all the time, or is it mainly when you're just struggling with this? Yeah. A slight little bit puffy at the moment, but I wasn't just sure if you were just a little bit tired, but so you get that quite a bit there. Yeah. Okay. Have you ever had any kind of lymph drainage massage at all? I definitely recommend you checking that out. See if someone can do that. That's salon for you. And I can do a little bit of lymph drainage, but it might be good if you can find like a salon somewhere that you can go to regular. Right, I'm going to press now. Is that sore? You're definitely tender all there. Okay. Okay, if I can get you to smile for me, and just keep in that position. Okay. Okay, if you can puff your cheeks out for me. Okay, just suck your cheeks in for me. So when you're changing face shape, Are you getting discomfort? Okay. Okay, relax. Right, can I get you to just raise your brows and hold? Okay, relax. Now, this might be quite difficult, but if you can scrunch your face up for me and hold it. Thank you. Okay, relax. Okay. Open your mouth for me. Okay, relax. Close your eyes. Okay, can open. How are you doing? Good. Right. I'm just going to shine a light over your face. I just want to double check I've not missed any lumps, okay? Okay. Excellent. Definitely not missed anything. That's good. Right, so I'm just going to bring it down. Any pain in your glands there? What about there? And there? Okay. Can't feel any swelling in your neck. Let's go on your collarbone. It feels fine. Okay. Any pain? Okay. Tell me if you feel any pain. All okay? Good. Right. Get you to open your mouth for me, nice and wide. Say R. Ever had tonsillitis or anything? Okay, pop this in. Say R. Okay. I'm going to pull your gum down. Up. Look in your cheek. Okay. Pop your tongue out for me. Say R. Lift your tongue up. Good. Relax. You can give me a little cough. Again. Good. Thank you very much. Right, so first things first, I need to check inside your ears with my little otoscope. Okay. Keep nice and still for me. And in we go. Looks nice and clean, nice and clear. Yeah, looks good. Can't see any problems. Other side. And there we go. Okay, no reddening, swelling, no signs of infection. Not really good and clean. Okay, both sides look great, not concerned. Now, can you hear that? Bass. That. Good. Hello, hello, hello. Hello, hello, hello. You can hear that all fine. Good. And you can hear me clearly, no problems. Okay, any history of hearing issues in your family? Okay, hear that? That's right, so you can hear it closer and further away. Now this side. Excellent. Just one more check. Tell me which side you can hear. Excellent, well done. You can hear, that's fine. Right, I'm just going to swap that and have a look up your nose. Okay, my love. Tilt back for me. I'm just going to put that there first on the edge. Okay. Sniff for me. Good. Okay. Right. I'm going to go in. That's it. Sniff. Okay, the other one. Sniff. Okay. It's really blocked, congested. Okay, I need to get my other camera and I'm going to pop it up your nose and have a look at it on my little machine. All right. Right. Excellent, that's all connected. Okay, tilt your head slightly. I'm going to pop that in. Okay, I'm just looking on the edge at the moment. Okay, I'm going to up higher now. All right, you're doing really well. Okay. That's it, tilt there, that's it, perfect, stay there. Okay, and go the other side. Good. Slightly higher now, tilt there, thank you. Okay, right. Right, I'm going to go up now. Okay, keep nice and still. Alright, you're doing really well. Just control your breathing. Definitely a blockage there. I think we have nose polyps, nasal polyps. Let's go with the other one. Okay, I'm going to go a little bit further. Alright. You're doing really, really well. Okay, can you give me a sniff? Okay, I'll back up the other one. Sniff for me. Okay, alright. You okay? Good. Right, I just need to take a swab. Okay, keep nice and still for me. I'm going to pop it in. That's it. It's going to go up, up, up. Good, well done. Other one. Here we go. Up, 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 up. Well done. Feeling okay? Good. I know this probably doesn't sound very pleasant, but if you can really sniff up for me and spit into there for me, okay? Thank you very much. Okay. Open wide for me. Side of the cheek. That one. Tongue. Lift your tongue up, thank you. With your mouth, and finally your throat. There we go. Alright, that's not very pleasant. Okay. Right, if you can just blow your nose, thank you. Okay, so now I need to take another. Okay, right way up. All right. And then we want that one. Okay. Good. Well done. Okay. Now I'm going to have to pop this back in again. Okay, relax for me. And in we go. Wonderful. Other one. Okay. Okay, I'm going to have to pop this up your nose. Okay, I'm going to give you a little sedative in just that area. Okay, it's a bit of a local. I know it sounds really scary, but you'll be all right. I won't feel it once I've popped that in anyway. Okay. Okay. Keep nice and still for me. I'm just going to inject there. A sharp scratch. There we go. Well done. Bit sharp. Okay, you'll start to go numb in a moment. Okay, I just need to leave that to kick in. We'll take some blood from you in a moment as well. Okay. Great. So, keep nice and still for me. I'm going to thread this up. Okay. Okay. Perfect. Okay. Keep nice and still. Just taking pictures. You feeling all right? You're doing really well. Good, well done. Okay, I'm going to bring that further down. Okay, I'm going to stop about there. The other side. Perfect. Definitely no nasal polyps. Good. Okay. There we go. All right. You did amazing. All right, well done. Right. I'm going to take some blood, okay? Okay, if I can have a feel of this arm. Pump for me. Pump. Is any arm better than the other? Okay. Just feel this one. Aha. That will do. Feels like a nice one. Right. Keep your fist a moment, please. Aha, great. Okay, if you just release slightly. Thank you, thank you. Okay, you ready? Sharp scratch. Excellent. Press that down. Well done. Okay, if you just hold that there for me. Thank you very much. Okay, that's good. All right, my love. How are you feeling? All right, so I know what's going on. So you keep getting sinusitis and infections. All right, you have chronic sinusitis, and what's actually in your nose is nasal polyps. You've got like lumps, kind of little growths basically, and they're blocking and different things like this, and we need to get them removed. All right, obviously I can't do that today. We'll have to book you in under a general anaesthetic. Okay, so my advice would be let you recover from today, write a report, and I'll get it sent over to yourself and your doctor, and I will get all these results done. So the bloods, the swabs, the saliva, etc. Okay, I will also send you off down for an x-ray just to be on the safe side in a moment. Okay, so you'll go and have your x-ray. Then I'll get all these results, and then I would like to see you again, and then we can go from there. All right, so I'll see you again in, if it's okay with you, in about 10 days. I think that'd be about right. Yeah, I think so. I think that could work. Yeah, so obviously I looked in with the camera, and obviously with a special camera, and did a little bit of suction. Okay, so I've got a little bit there. That is nicely here for testing. Okay. Yep, you wouldn't have felt that. I just took a little snip like that, so it's fine. I deliberately don't tell my patients because they start to panic. So yeah, that's just a little, like, in a way like a biopsy, right, just to test those little areas. All right, good. And then if you come back to me in 10 days, I'll have all the results of everything. We can go over everything, and then we'll go from there. And then we'll have to obviously book you in for surgery and get those polyps removed. All right. Hopefully it's nothing sinister, which it shouldn't be, because they just look like classic polyps to me. I've seen them numerous times, more than you can even think of. Yeah, but it's just the standard procedure that we have to do. Either way, they're coming off. All right. Yeah, so that will settle down. But what I'm going to give you for the moment is, I'm going to suggest that you have certain medication. I will send it over to you, and I will get your GP to instruct you. There's going to be high strength nasal spray. Okay, it's going to have to go right back and down. All right, and a course of antibiotics just to settle everything down. Okay, because I need to prep your nose and everything for surgery. All right. Okay. Yes, exactly that. So that will start to wear off soon, and you'll feel fine. If you do feel any pain or discomfort, take some pain relief. Okay, some anti-inflammatories and just some paracetamol or something, just to settle that area. Yeah, you may feel a little bit strange, a bit more snuffy, and don't be surprised at some point if you do get a bit of a nosebleed. It's perfectly normal. At the moment, there's nothing, so all right, got nothing to worry about. But do you have any questions? Okay, so do you understand what's going on and where we're going from here? Great. So if you just go into reception, and I will get somebody to come and take you down for your x-ray. All right, then I will see you in 10 days. You're very, very welcome, my lovely, and you were amazing. You take care now. Bye-bye.